Philadelphia's city health centers offer very low-cost health care to all residents of the city but are overcrowded. Public Health Center 10 on Cottman Avenue is the only one city health center serving the entire Northeast, it taking up to a year for a new appointment. 2 new health centers are included in the Philadelphia city budget in the lower Northeast, one at the Frankford Transportation Center Bridge and Pratt and one at the Old Friends Hospital on Roosevelt Blvd, near Langdon St. They will provide care for over 46,000 patients a year, mostly at the Friends site. There is opposition to the health center at the Friends Hospital site, despite the critical need for more capacity for city health centers. The opposition can put a 5 years delay for the city to locate another suitable site. Therefore, community, religious, labor, immigrant, and social services organizations have come together forming an informal coalition to support the health department's plan for the 2 new health centers. The coalition has gathered more than 1,200 signatures supporting the Friend Hospital Health Center. Councilwoman Quetzi Loizada and the Philadelphia Department of Public Health held a series of public meetings to allow community members to provide input to this project.
I work with immigrants from many parts of the world, and I hear these stories that because they cannot make an appointment at the health center on Cottman Avenue, they have to go to South Philadelphia, to Center City, to West. They have to travel long distances. They have to spend money. They have to give up working days. It's a lot, and it's just not fair. Or if you look at the statistics of growth population in the Northeast, you will find that almost every zip code has between 24 to 26% of foreign-born population. It means that population has grown, but city services have not grown. Actually, they've been reduced.
Our neighborhood group was asked if we would support the Mazzoni Center moving in to our neighborhood. And I have to tell you, our neighborhood at first was opposed. We were very concerned about the clients and what it would do to our neighborhood. We did have some religious leaders who came and said to us very, very forthrightly, "What are you doing? Don't you believe in all of what you say you believe?" And the community finally said, "Okay, stop fighting." Here we are, 3 years later. They have been great neighbors. They have helped the neighborhood tremendously. In fact, we actually now have the opposite problem. They've been so great for our neighborhood that property values are going up.
Nice.
And if we could talk to the former council person and the current council person, please don't reassess us. We should have opened our arms and said, we need health care. Waiting a year can be a death sentence. They would see how successful it's been and how right they were to put it there and how wrong the neighborhood group was to fight. Thank you.
So I think I'm in a unique position because I'm currently working as a pharmacist at the Friends Hospital, as you can see on my name tag here. So with the selection of the Friends being a potential site for the new health center, we already know the benefit. The question now is where would be the good location that benefit the community. So through my informal kind of communication with the internal staff at Friends, we are all really supporting and hopefully for the plan to become, fruitful, become fruition. In medicine, we are weighing the risk versus the benefit ratio. Whatever treatment you choose, whatever medication you choose, the benefit gonna outweigh the risk in order for us to implement that treatment. And here, using the benefit to the community for generation to come, as we're gonna serve across the lifespan, from pediatric to senior to adult medicine. I think in this case, the benefit is really outweigh the risk, which can be safely managed. There is a will, there's a way.
In 2020, we put speed cameras on the boulevard, and they are having a profound effect on traffic safety. And we projected that we have saved 36 lives by putting those up. We're going to be spending over $100 million on traffic safety improvements on the boulevard. That'll be complete by 2029.
Friends is a perfect place for this. It's big, it has parking, it has, it's accessible. People will go there. I just think we should make up our minds to build it and build it fast.
My name is Pearl Min Chu Hoen. I'm the president of the Northeast Philadelphia Chinese Association, and I have a very tight connection with Health Center 10. 6 years ago, I was working as Chinese interpreter at Health Center 10 for 3 years. Every day I see people come and they need appointment. We help them make appointment. But our heart was broken because we cannot get them an appointment soon enough. And most of these people are regular immigrants. They're underserved. They don't speak English. And meeting like this, you want the community to come, those people don't know about it. They didn't show up. So if you want to hear the voice of the community, you usually don't hear it, but don't ignore their needs.
Yes.
You know, you may think like you're concerned about their safety, but there's no safety if you cannot treat yourself and you don't have the money. So the healthcare is really urgent. You know, every day I pray that we have more health center to let these people get help. We don't know too much about how you choose the site. For people who have money to get health care, they can wait. But for new immigrants, they're underserved. We have to think about that. I live in the neighborhood. I shop at the Home Depot. And that piece of land, it reminds me of the Dracula castle. I don't know what it is, you know. Unfamiliar to us, even we live right in the neighborhood. But after this meeting, I started to find out of Friend Hospital what it looked like. I went to YouTube and see that inside the beautiful building. And at the first meeting, I thought someone going to tear down someone's tombstone or something. Why I was so excited, you know. But then I find out that the city only tear down the dilapidated building for the benefit of the public. So I feel very grateful for the city doing all of this work, you know, because as the commissioner said, if we fall back on this plan, it takes another 5 years to restart and get another site. You know, I appreciate all the neighbor concern, you know, for the traffic, for the historical site, but our community cannot wait for another 5 years. Please, you all, with good intention, maybe become bad because you make us wait for 5 years. It's every year the health center can serve 30,000 people, and 5 years is 150 people lost the chance to get the health care. How can we be good neighbors? We all talk about compassion and want a good thing happen to our neighbor. Want people to get healthy. And how can they go against it? I don't understand. Maybe God can tell them justify this. But this is for the good of our community. We got to have it. And just talk about the number. I went out to do a petition. And my partner here, John Cox from the Philadelphia Unemployment Project, he gathered 400 people to write postcard to the city councilman, and my organization, we had at this time 1187 people signed.
Yeah.